You're listening to the Public Health Entrepreneurs Podcast with your host, Dr. Charlotte Huntley. Here's a question that might sting a little. What if the biggest threat to public health isn't underfunding or policy barriers, but public health consultants who are too afraid to charge their worth? I know that sounds harsh, but stick with me here because what I'm about to share could completely change how you think about money, sales, and your impact as a consultant. Welcome to Public Health Entrepreneurs, the podcast for visionary leaders who are ready to transform public health and healthcare through innovation. I'm your host, Dr. Charlotte Huntley, and as a public health entrepreneur with over 25 years of experience in healthcare and public health, I understand the unique challenges and opportunities that come with bridging multiple disciplines. Now, if you are an interdisciplinary professional, meaning a high-functioning leader with expertise across different fields, then you are in the right place. In the previous episode, I shared tips for sales conversations, leading to opportunities for greater impact. I know that people have mixed feelings about the topic of sales, and I asked you to make a mental note to yourself to explore any mindset issues you have around sales and money if the sheer mention of it makes you uncomfortable. I also share that I also can relate to all of this. This is me. But, early in my journey, I invested in coaching for myself to address thoughts around money and to develop professional sales skills and a healthy relationship with the process. Here's the brutal truth. While you're busy feeling noble about your low rates and apologizing for your prices, less qualified consultants are charging premium rates and getting hired over you. Meanwhile, the organizations that desperately need your expertise are stuck working with consultants who talk a good game but don't have a fraction of your knowledge or experience. This isn't just bad for you, it's bad for public health. Today, we are going to fix that by tackling 3 of the biggest mindset blocks that keep you small and your impact limited. All right, let's jump into this. Here are 3 ways that public health consultants can address sales and money mindset blocks. These are not the only 3. I just decided on these 3 to talk about on the podcast. So number 1, identify your personal money story origins. Trace back your beliefs about money to its roots. Like, are there family connections? Is there something early in your family that was said or spoken often about money that some of your blocks or stories originated from? Maybe it has to do with academic training. Does it stem back to something that you heard in academia or somewhere, along the process of earning your degrees, education, so forth? Or early career experiences, maybe in nonprofit organizations. Sometimes we have these phrases. I know we've all heard, I didn't come into public health to get rich. We hear that a lot. And if I wanted to make a lot of money, I'd be doing something else. So that's really, I won't go too far down a rabbit trail. But a lot of those things are spoken early in careers, and you hear it in your educational training often. And then with money and family, sometimes it is, the family will talk about those family members that have a lot of money and how they're snobby and not very warm and they act like they're stuck up or, it's a bad thing to have a lot of money. And sometimes there are certain family members that get a lot of attention and it's almost glorified to be on the struggle bus. Sometimes it has, maybe if you grew up in the church, you may have grown up with some negative connotations about what it means to have a lot of money. Not all churches are like that, but I just know that a lot of people have some of those roots back into some of their early days with church and religion. And so explore, trace back these beliefs to the roots and the origins. Some of the questions you might ask yourself is, what did I learn about money growing up? Or what messages did I absorb in graduate school about commercializing health expertise? I don't know about you, but I've heard a lot. The more you grow in your business, the larger you get, the more you may hear or people will start to have a problem with you. Sometimes they're okay if you're starting and kind of putting this thing together, but when you start to really establish yourself and start to really build a sustainable business and you get some momentum, some of those attitudes will shift. If you haven't experienced it yet, which I know a lot of you listening have already, you know what I'm talking about. It's coming. So don't be surprised when it happens. But some of these money stories you have a very personal origin. And so if you can trace that back, identifying it is really step one. And then you can decide what to do with it. I'm going to add a little extra here because I don't know if I've covered this on a previous episode or not, but it's worth mentioning again. So if you're hearing it again, it's a nice reminder. I think it's very powerful to, once you've addressed these, sometimes it comes up if you like journaling, this is a good practice. You can write out, what are these things in your relationship with money, what you heard if there's a personal connection to your family, your school training, early career, whatever it is, write it out. And then sometimes you can take what you write, what was written in a negative tone, like what you heard or what you were told, and you can rewrite it into a positive affirmation that you can read to yourself on a regular basis. It goes a long way with helping to reframe some of that negative programming that you may have heard along the way. All right. So identifying the origin story of around money is a powerful step, a powerful strategy, because once you become aware, then you could do something with it. But if you don't ever really address it, it just plays on repeat in your head and you just are constantly in this cycle. All right. So number 2, this is number 2 in a priority of more importance, just 2 of the 3 things I'm going to share with you about ways that you can address some of the money mindset blocks. And number 2 is reframe the sales as a health assessment or intervention. I thought this would be kind of a fun, kind of a twist. And this goes well with the previous episode. So make sure that you listen to that as well. But view sales conversations through their existing public health lens. So just as you would assess a community health needs before designing an intervention, you can assess an organization's needs before proposing solutions. So a prospect, an organization that you're talking to about your services, treat it as an approach to a community needs assessment. Think of it that way. Again, when you're doing a community needs assessment, you're going to be assessing the needs before designing an intervention. So if you equate that to the sales process, you are assessing that potential client organization needs before you craft the proposal or the solution. It's part of the sales process. Let's go a little bit further. Think about it this way. Assessment could be like a diagnostic question. So in the assessment phase, you're asking questions. You're trying to understand, identifying the root problems. That's part of the diagnosis. Like you decide, okay, you're through this assessment phase, you're asking questions so that you can identify what the problems are. And then you develop a treatment plan. So that's the same as your proposal. Once you have the conversation, you identify the problem, you diagnose the situation, then you develop the treatment plan. Your proposal is going to outline these services that you can provide to address that problem. And then the follow-up. Follow-up in the sales conversation or in the sales process is the same as that ongoing support. When you deliver the treatment plan in the clinical setting or any healthcare setting or any community assessment, then, you follow up, or maybe it's, the improvement plan, the implementation part of that. It's that support to follow up to say, okay, I proposed this to, be the solution to the problem that we discussed. Are we ready to move forward, right? Get signatures and move to contracts. It is, maybe that could be, for some of you, that could be a great way to kind of turn it around into something that feels more comfortable and familiar in terms of a process so that you can start to feel better about the sales conversation and the entire sales process. All right. So number 3, create boundaries between mission work and business work. So let me clarify, because I'm saying mission work, but I know that a lot of your business has a mission statement, like my business has a mission statement. But what I'm talking about is more your philanthropic arm, right? So establish clear boundaries between your volunteer or advocacy work, which you might do as free or low cost, and your professional consulting services. So create separate buckets for different types of work and be intentional about when you choose to work pro bono versus when you charge your full rate. All right. So I do this, and this helps quite a bit. There are certain things that I provide absolutely free of charge. It doesn't mean that it is completely free. There's a cost for me. And a perfect example is my podcast platform. This podcast, I share valuable tips on every single episode. I'm coaching and guiding through this podcast, and it's provided as a platform that all of you can consume at no charge. It certainly costs us money to produce these episodes, but we are making it available for free. This is a part of our mission work, or our free to you philanthropic arm of the business. We are able to reach people, and I produce multiple podcasts. So my other podcast, it's the same. We're in episode 400 and something. I can't even remember, but it's over 400 episodes. I have to have it in front of me. We hit the 400th episode milestone earlier this year. So for 400 weeks, I've been providing that as a free resource. It has helped me to really attract a lot of people from around the world. And some of those people I actually get to work with. So same thing on this podcast for public health entrepreneurs. I reach a lot of you who listen to these episodes, and you get a lot from these episodes. And I'm really happy about that, because I'm able to serve so many more people through the podcast than I could if you all wanted to work with me one-on-one, or you all wanted to join my mastermind. But there are some people who listen to the podcast and then decide they do want to work with me one-on-one, or they do want to work with me in my mastermind program. And then we move to that phase or that role of the process. So there are, in my buckets, there's this podcast, what I would give for free, what I'm able to share on these episodes. And then there is the other bucket for full services, where I work more closely and more deeply with clients who want to move in and go to that level of the sales conversation and process. So you do the same through your services. Now that is just here as this public health entrepreneurs, but I have a full consulting, epidemiology consulting firm, and they're the same. It's not just the podcast that is a free platform. Sometimes I provide services. So for example, I do facilitate a lot of premium workshops for organizations, and I do a lot of capacity building. I speak on stages, and not every single stage is a paid opportunity. There are sometimes I'm invited to speak on a stage for an event that I decide fits into this philanthropic bucket for a number of reasons. It may be that it's a wonderful opportunity for me to get in front of an audience of my ideal client types of people, and it's an opportunity for me to network and connect with people that potentially may work with me in the future as a consulting client, and an opportunity for incredible networking and to be in that space. So there are sometimes I say yes to those opportunities, and they're usually, I wouldn't say completely free. Sometimes they're a lower cost. So maybe there's like a covered expenses, but there's no actual, or maybe like an honorarium as opposed to a full market rate salary for speaking and leading on stage. So there are times when I will say yes to a no or low cost opportunity to speak, because it positions me, there's some benefit to doing that. Or maybe I just really care so deeply about the organization, its mission, what it's trying to do. And I do donate my time and my energy and my expertise in that way, because so many other opportunities that paid well and market rate allowed me to have that freedom to say yes to some of those free or low cost opportunities. So I'm diving into this really deeply, but in essence, I want you to be able to create boundaries around those two buckets. You know, what is my philanthropic or volunteer advocacy work, my mission work, and then what is my full rate, full service business work. And maybe you have capacity for one or two free volunteer advocacy or low cost types of projects per year. Or maybe it's for every, I don't know, 4 or 5 of these paid opportunities, you're able to give one back. You get to decide, because you're the entrepreneur and it's your business. But I think separating them goes a long way to helping you feel that you get to be very generous and do these things. A lot of us, I think, have this heart to give and to serve without needing to charge. You want to volunteer and you want to advocate and you want to be available pro bono sometimes. But you are running a business, and like I said, it's you get to decide which one, where those boundaries are, and how that works for your business. So here's what I want you to walk away with today. Your money mindset isn't just a personal issue. It's a professional responsibility. Every time you undercharge, you are actually devaluing the entire field of public health consulting and making it harder for other qualified professionals to charge appropriately. But more importantly, you're robbing organizations of the chance to work with someone who truly understands their challenges and can deliver real results. So here's your homework. I want you to pick one of these 3 strategies and commit to implementing it within the next 7 days. And I need to put a time on that. So I won't just say soon or in the near future, but I really want you to commit to implementing one of these 3 strategies within the next 7 days. From the time that you're listening to this episode, you count 7 days. So maybe that means having an honest conversation with yourself about where your money beliefs came from. Or maybe it's reframing your next client call as a health assessment instead of a sales pitch. Or maybe it's finally creating those boundaries between your mission work and your business. Whichever you choose, remember this: charging what you're worth isn't selfish. It's strategic. It's sustainable. And it's exactly what the field of public health needs right now. We need more of it right now. Now, go out there and start acting like the expert you already are. If you need guidance and support to help you apply these strategies that I've shared with you on this episode, then I invite you to explore the opportunity to work together, either one-on-one or in our mastermind group program. As someone who understands the unique challenges of being an interdisciplinary leader, I can help you customize your strategic next steps. Just visit publichealthentrepreneurs.com to learn more. Links are also provided in the show notes. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. Visit publichealthentrepreneurs.com to learn more.